Hi, I'm Professor Dr. Shetty. I'm going to talk to you about colon and rectal cancers. Rectum and colon are probably the most important organs in your body because whatever you eat or do in this world, finally it's all going to come out from there. How important is this that you are aware of the colon and rectal cancers? You have to understand is that whatever you consume is finally going to get metabolized in the body and it forms stools and it comes out. The maximum brunt is borne by the colon and the rectum. It is very simple. If you have a healthy diet for one day, the stool consistency is different the other day. People complain about constipation all the time, but they do not want to improve on their diet. One of the biggest problem of an irregular bowel habit, apart from say infection or Crohn's or some other things immunologically, but most of them is related to a bad diet. What do you mean by bad diet? It's about a carbohydrate rich junk food that we talk about is what creates a maximum problem in the body. What do we need? We need a lot of fiber. We need to drink a lot of water. We need a lot of ingredients. We take nutritious food. So everything nice when you walk into a mall, and if you go to the fresh food sections, all those greeny, red, blue, green, shiny things that you see are the ones which are probably good. Anything which is processed is the one which is going to give a problem. The problem lies there. The problem is processed food. And one of the reasons, apart from, when we talk about lifestyle related disease, so breast cancer, colon cancer, endometrial cancer, ovarian cancer, are all related to a lifestyle disease, and that is food and the environment we live in. We probably cannot change the environment, but we can change the way we eat, the way we exercise, and that is in our hand. Colon and rectum cancers are very common. If any adult male has low hemoglobin, it does not mean that he is cancer, but you should rule out a cancer in the colon. Piles, hemorrhoids, as commonly known as, is one of the most common reasons why people have blood in the stools. But as you grow older, you have to be very careful about what you have. Singularly, if there is a bleeding, it does not mean everything is a hemorrhoid. The simplest test is to get a colonoscopy, and that is what we advise after the age of 50. At least once you should do a colonoscopy to see if there is a problem, and especially if you got a family history. Sometimes there is change in the bowel habits which is not normal. Constipation, diarrhea, constipation which has not been treated, you should go for it. These are curable disease. We don't do those ghastly big surgeries or big abdominal incisions anymore. Nowadays we do with minimal invasive surgery and robotic surgeries that we do these surgeries. There was a time when most of the rectal cancers there is to be a permanent bag. Now we talk about rehabilitation. We talk about continuity. We talk about low anterior resection, and the best effort is made to maintain the continuity so that patients can pass stools normally. The way we treat cancer has changed. The way we treat rectum cancer has changed. We start with radiation most of the time and then give surgery. Multidisciplinary team has helped us in revolutionizing. Research has told us, and with good medicines, even if you have a liver metastasis, still we can get a good quality life in colorectal cancers. But remember, the smallest, if you detect the disease early, it is cheaper and you live longer.